Hello, my name's Teifi. I am a final year medical student at Cardiff University, and today I'd like to talk to you about my research project that I conducted alongside the Anaesthetics team in Bridgend, titled "Which CPET variable is the most significant predictor of post-operative outcomes in colorectal patients undergoing major intra-abdominal surgery?" We know that large operations, such as major bowel resection, place significant demands on patients' reserve. But what if there was a way to predict post-operative outcomes in order to guide perioperative care? CPET stands for cardiopulmonary exercise testing and consists of the patient pedaling on a cycle whilst they are connected to a gas analyzer and an ECG machine. As the patient's work is incrementally increased, values such as the patient's anaerobic threshold, peak oxygen consumption and ventilatory efficiency for carbon dioxide can be calculated. By looking at retrospective data from 101 patients who underwent CPET testing prior to their major bowel resection, this project looks at the relationship between individual CPET variables and post-operative outcomes, such as length of hospital admission and morbidity rates. So what did we find out? So our study found that from the mean anaerobic threshold, VO2 peak and VE/VCO2 for the cohort as a whole, patients who presented to the Princess of Wales Hospital for CPET testing prior to major intra-abdominal surgery were generally unfit. We found that cardiopulmonary fitness was a strong independent predictor of morbidity, but not length of post-operative hospital admission. We also uncovered that a low anaerobic threshold, so that below 11, was the strongest independent univariable predictor of morbidity. However, VO2 peak and a high VE/VCO2 also showed promise. So what to do with this research that we've performed? So we recognise that further research is required in order to strengthen the association between individual CPET variables and post-operative outcomes. However, we hope that this study will be useful as supplementary evidence to support the commencement of a prehabilitation programme for colorectal patients in Bridgend. So enrolling them in a fitness and dietary programme in order to improve their cardiopulmonary fitness, in order to mitigate the potential for post-operative complications and enhance outcomes after surgery. Thank you very much.